Action News. I'm Keenan Smith, your anchor, and we have a breaking news story about SARS outbreak in the Calgary metro area. What is SARS? SARS is a severe acute respiratory syndrome, also associated by coronavirus, also called SARS-associated coronavirus. We're going to get you some more information with our field reporter, Holly. Take it away, Holly.
Thanks, Keenan. I'm coming at you live from Foothills Hospital, where I'm meeting two paramedics and a patient who are dealing with this challenging respiratory disease. Kevin, what can you tell me about this?
Yeah, well, SARS is caused by a strain of coronavirus, which is the same family of viruses that causes the common cold. It spreads when droplets enter the air from someone who is dealing with the disease, when they cough, sneeze, or even when they're just talking. And it can also be passed on through contaminated objects.
Wow, that's awful. Yeesh. What can you tell me about the pathophysiology and the causes of it?
Yeah, so severe acute respiratory syndrome, or SARS, it's been being called recently. It's a viral infection that attacks the epithelial tissue of your lungs, causing diffuse alveolar damage. Once it gets bad enough, it can move on to the tubules in your nephrons and your kidneys, the lining of your intestines, and even attack neurons in your central nervous system.
Okay, Kyle, are you able to tell me about the level of consciousness of the patient?
Yeah, of course. So in most patients, you're not going to notice a change in level of consciousness. It's only when they're in severe cases, about 7.5% of the time.
Okay. And what about the airway, breathing, and circulation?
Their airway, they're going to find that they have a sore throat. Maybe there's a little bit of swelling and dilation going on there. There's going to be a little bit of mucus secretion. They're going to get that disgusting green phlegm coughing it up, which is a good thing. Get that out of the body. As for the breathing, they're going to have a little bit of trouble breathing. It's going to be poor air exchange in the alveoli there, because that's where the damage is occurring, obviously. As for circulation, not much direct influence of the circulation. It's more an indirect. With that poor diffusion, you're going to get hypoxic patients, and that can be a bit of an issue, but no direct circulatory issues.
Okay, and what about lung sounds and head-to-toe findings?
For the lung sounds, you're going to find that your patients have fine crackles with most SARS cases. In severe ones, you're going to get Velcro crackles, It's going to be awful sounding, awful. In really, really bad cases, they can develop pneumonia, where then you're going to start to hear some bubbling in the lungs there, and that's just as fluid moves into the alveoli. Not supposed to be there. Lastly, the head-to-toe, you're going to find that your patient's tripoding quite a bit. You're going to notice a lot of accessory muscle usage, a lot of work breathing, and maybe if they are in that severe state, you're going to notice a little bit of cyanosis.
Thank you. Kevin, are you able to show us how you do your assessment and share with us what the findings are?
I'd be happy to, Holly. We start with taking an ample history from our patient. So, Connor, do you have any allergies?
No.
Are you currently taking any medications?
I have a puffer.
Do you have any past medical history that might help us to understand what's going on for you today?
Yeah, I smoke a lot and I have asthma.
Oh, geez. What was the last thing you ate?
I had a cheeseburger an hour ago.
And what were the events leading up to you giving us a call today?
I had a fever about a week ago and it's just been getting worse, and now I have respiratory problems.
Okay, got you. Thank you for that. Are you experiencing any pain at all?
A little bit in my lungs, yes.
Yeah? Okay, I'd like to kind of find out a little more about that pain. When did that come on for you?
In my lungs maybe 2 days ago, but I had a fever about 4 days ago.
Okay. Does anything make it worse, provocate it?
Whenever I breathe, or I cough, or I talk, just
Okay.
any respiratory,
Can you speak to the quality of how that pain shows up for you?
I would say it's a sharp pain, maybe 7 out of 10.
Okay. Does it feel really localized when you cough, or does it spread out and radiate?
It does not radiate, no.
Scale of 1 to 10, how bad would you call this pain?
About a 7.
Remind me when it came on for you that you started to feel this?
A fever about 4 days ago, but respiratory problems maybe 2 days ago.
Okay, thank you. And is there anything that you can do that help alleviate the pain, or maybe me or my partner could help you with?
When I go in tripod position, that helps, but other than that, no.
Okay. Thanks for answering all those questions. You just stay in a position that's comfortable for you, and we're going to do what we can to help alleviate some of these symptoms.
Thank you, sir.
And at your scope of practice, what is your pre-hospital treatment?
So for our buddy Connor here, what we're going to do is we're going to continue doing an ongoing assessment for him. I'm going to give him a little bit of oxygen therapy, which is going to help him breathe a little bit better. He's going to get some antipyretic therapy, which is going to bring that fever down, make you feel a little bit more comfortable. And lastly, if he develops any sort of wheezing or anything like that, we're going to administer some salbutamol and ipratropium bromide. Isn't that right, buddy?
Thanks guys for all the information, and back to you, Keenan.
Thank you, Holly. So, what is SARS? It's a severe acute respiratory syndrome, and you might be wondering, how is it most readily transmitted? By coughing, sneezing, any kind of droplet through the air that gets projected. So make sure you cough into an elbow, wear a mask, and yeah, just don't be gross. So yeah, that's all we have for today. I'm gonna thank the paramedics at the Foothills Hospital, and yeah, stay safe out there.